There are several steps involved in taking a blood pressure measurement, and each step must be completed with accuracy. This is especially true when viewing the blood pressure dial and listening with the stethoscope. You must be able to effectively coordinate what you're hearing with what you're seeing. Just imagine if you recorded a patient's blood pressure as normal, when in actuality their pressure was extremely high and they were at risk for having a stroke. Your inaccuracy can have dire consequences on the patient's overall health. This lesson will help you achieve accuracy when taking blood pressure measurements. By the end of this lesson, you will identify and interpret the graduation markings on an aneroid sphygmomanometer dial, and determine the systolic and diastolic blood pressure by reading the dial and listening to the Korotkov sounds. If you ever had your blood pressure taken, you likely noticed that the results were stated as one number over the other number, such as 120 over 80. The number on top, in this case 120, represents the systolic pressure, and the bottom number, in this case 80, represents the diastolic pressure. Let's take a close look at the dial used for determining such a measurement. This is the aneroid sphygmomanometer dial, also known as the blood pressure dial. The dial has the letters mmHg because blood pressure is measured in millimeters of mercury. Also on the dial, you'll notice that there are lines in various sizes. The largest lines represent values of 20. This is 20. This is 40, 60, and so on. The medium lines represent values of 10. This is 30, 50, 70, and so on. And the smallest lines represent values of 2. So this line represents 22, 24, 26, 28, and so on. Now let's use the needle to determine the number displayed on the dial. Concentrate on the tip of the needle and the line that it's pointing to. How much does this line represent? If you stated 68, you are correct. So how much does this line represent? If you stated 112, you are correct. And how much does this line represent? If you stated 294, you are absolutely correct. Great job. Now that you're comfortable with reading the blood pressure dial, let's apply audio-visual coordination skills. And for this, please increase your volume level and have a pen and paper on hand. There are two main areas that you need to focus on when determining a blood pressure reading. 1. The position of the needle on the dial, and 2. The Korotkov sounds. We will refer to the Korotkov sounds as thumping sounds for the duration of this video. When you arrive at the point of the procedure where you slowly deflate the cuff to hear the sounds, you will notice the needle move in a counterclockwise direction. It is at this point that you need to listen very closely for the thumping sounds. Upon hearing the first thump, note the needle's position on the dial and record the number. That's the systolic pressure. As the cuff deflates